there, because most people, when they go to urinate in another person's toilet, they are not relaxed. They are always in a hurry to come out when they go to toilet there. Sometimes they didn't even go to toilet, they just went to urinate. After urinating, you see them, they will just clean like this and come out. Now, because they're in a hurry, they actually end up contaminating the urethra with the content of the anus. And when that happens, they will come and start having urinary tract infection. Some of them will tell you that we use another toilet. I went to somewhere and I used their toilet. The toilet is not very clean. On that note, I got urinary tract infection. It's not like that. Most times, it is self-contamination. When the person contaminates the urethra from the content of the anus. Is it clear? Then we now go to the symptoms. And we talked about the symptoms. Symptoms are the thing that you will see. You will now realize that it is possible that this person might have urinary tract infection. The easiest one is that that area starts irritating. Now, the bladder will now notice that there is something wrong. Something that doesn't belong to us is here. I don't know if you understand. So on that note, any slightest thing that enters the bladder will want to push it out. So once small urine collects in the bladder, that person will start feeling the urge to urinate. And he will just go to the toilet and urinate a very small urine and come back. Since the time we started this lecture, that person might have urinated 2 times. In fact, sometimes they got afraid of going to enter the bus, because before you go from here to Liberty, that person has urinated again. So that frequent irritating urination is the commonest symptom. Okay? And again is that there is this painful urination, especially at the end of the urinating. When that person just finished urinating, you just see that there is something that looks like electric shock that they and stop again. So it's a frequent thing. I don't know if you understand. Then it's just that it's classical. And because it is classical, when you see those symptoms in a younger person, and the symptoms are classical, that this is urinary tract infection, since we know that most of them are caused by E. coli, most times there might be no need for culture. But sometimes people will come and say, I want to do culture first before I know the organism that is responsible. It is only when urinary tract infection occur in the area where you don't expect it to occur. I don't even, but if it occur in a younger person, we don't usually request for culture. In fact, sometimes urinalysis alone is more or less more informative. Because once you do urinalysis and you see WBC that is numerous, you see nitrites in a woman, you might just conclude it's urinary tract infection. But most times, the standard is that it's not in all cases that you will now start saying, let me go and do tests. Unless when that person has become debilitating, you might go vomiting, there are systemic symptoms. You are now thinking, how much of ascension has occurred? Because we said there is ascending urinary tract infection, there is a descending urinary tract infection. That brings us to the treatment.